Got a couple people here. People are logging in. How's everybody doing? Happy Tuesday. This is my regular Tuesday tutoring session where I do a different NCLEX or test taking tip. So I appreciate you guys taking some time out of your Tuesday afternoon to spend a little bit of time with me, and we talk about test taking, talk about the NCLEX. Tell me where you're from and how far away the NCLEX is for you. Marissa, what's going on? Minnesota. Another Minnesota, September 3rd. Chance. $2 a.m. in Singapore, Krishna. Well, thanks for hanging out with us. My brother Tony, he works here at NRSNG as well. He used to live in Singapore. He worked with a large bank over there. Seattle, hey, Gailey, I'm going to be in Seattle next week just for family vacation. I love Seattle area. Start my final class, take the NCLEX in January. Awesome. Chicago. I was in Chicago last fall. Sacramento, nice. We have a couple employees who are from the Central California area. Kentucky, I was out in Kentucky last year too. Cool, guys. Well, thanks for spending some time with me. We're going to talk about NCLEX, two NCLEX different test strategies. Now, these strategies come from the NCLEX or the test taking course that we have here inside NRSNG. So you can go back and refer to that again. But what we're going to talk about today is, hold on, let me share my screen. All right. So what we're going to talk about today, guys, is two different NCLEX test taking strategies. And these are pretty simple strategies. This is a pretty simple way to approach questions, and they really go hand in hand. So usually I talk about all 11 total strategies, but these two go hand in hand really well because they kind of deal with the exact opposite of each other. All right, so let me present this really quick. So again, like we always talk about here, and like I always try to stress with you guys, is tips and tricks and strategies and hacks and all those things are helpful. But the most helpful thing is the knowledge. So while these tips and strategies that I give you guys every Tuesday can be helpful when you go in and take your NCLEX, realize that knowledge is king. It's more important that you understand, that you know the content. But as you go in and take that test, some of these strategies and hacks and things can really help out. So the first one is opposites. What this deals with, guys, is when you encounter a question, and in that question, you have answer options that say the exact opposite thing of each other. For example like hyperkalemia, hypokalemia, acute versus chronic renal failure, fluid volume overload versus fluid volume deficit. If answer option A is hyper, answer option 2 is hypo, one of those answer options is usually the right answer. Now, this isn't a hard and fast rule, but if you do read 4 answer options and 2 of them are saying the exact opposite of each other, evaluate those 2 answer options first. There's a high probability that one of those answer options is going to be your correct answer. So start there and figure out which one of those is probably the right answer, and then evaluate your other 2 answer options. But realize that when it's saying the opposite thing, it's trying to know if you remember the difference between different signs and symptoms, between different disease processes, the exact polar opposite end of those different disease processes. Okay? So does that make sense, guys? Good. And you're going to see this a lot. This is a very common question type, a very common answer type that you're going to see on the NCLEX, all right, or giving you exact opposite answer options. All right, let's do an example of this. And I don't want you guys, don't answer until we have everybody answer, okay? So the physician orders anti-embolism stockings for a patient. When should the anti-embolism stockings be put on? Now let's assume that you don't have a clue. All right, let's assume that you really have no idea when to put anti-embolism stockings on. So you start reading your answer options. You say, while the patient is still in bed, when the patient complains of leg pain, when the patient's feet become edematous, or after the patient gets out of bed in the morning. Now, don't answer yet. Which answer options are saying the opposite of each other? Yeah. 1 and 4. Yeah, so there you go. Yeah, okay. So 1 and 4. One is saying while the patient is in bed and after the patient gets out of bed in the morning. Now, again, this is a pretty simple one. You know, it's like in bed or out of bed. And SED hose or anti-embolism stockings are something that we cover, you know, during first semester of nursing school. But let's assume this is talking about something much more complicated, Hashimoto's syndrome or DIC or something like that, and you're really not sure. Try to find those two answer options that are saying the exact opposite of each other. All right, so let's answer this question. So 1 and 4, let's evaluate 1 and 4. When should we put on anti-embolism stockings? While the patient is still in bed or when the patient gets out of bed in the morning? Perfect. Yeah. You guys all got it. Good. Yeah. So the physiology behind this, right, is if we put our feet down, if we put our feet dependent, all that fluid in our body's going to come rushing down to those feet. We're going to have these massively edematous feet, and then we're going to be trying to put those SED hose, those anti-embolism stockings on those hose. Have you guys ever tried to do that before? Who here has put on anti-embolism stockings on a patient before? Give me just a yes. Me. That's good. Me, whatever. It's not easy anyway. It's generally pretty complicated to get those on in the first place. So imagine dropping those feet down, having them become extremely edematous, and then trying to get that on. It's like trying to get, like, you know, those hose around a big old filled up balloon. So it's not going to work. All right, so that's opposite. That's the testing strategy, the testing hack for opposite. If you see two answer options that generally say the exact opposite thing of each other, move on, don't evaluate it, and keep on going. Now, let's talk about same. If you see two answer options that are essentially saying the same thing, you've got to move on. Both answer options can't be right, so both of them must be wrong. All right? The example I like to give of this is, for example, let's say, you know, you have a patient or the question says, which of these patients would you administer medication to first or something like that? And one of the answer options is a patient who says their pain level is an 8 and a patient who says I have really, really bad pain. Well, pain level of 8 and really, really bad pain are kind of the same thing, so we must move on. So anytime you see answer options that are essentially saying the same thing, they are both, because they both can't be right, they both must be wrong. All right. And I don't have an answer, or I don't have an example of this one in here, unfortunately. But you guys are going to recognize this when you see it. Maybe it says a patient has hypernatremia, and another one says the patient's sodium level is 152. All right, and they're usually going to be pretty obvious like that, like, and just making sure you understand signs and symptoms, or you understand different terminology or different ways of saying things, okay, or understand normal lab values or normal signs and symptoms. So if you see ones that are essentially saying the same thing, because they both can't be right, ignore both of them. And that takes you from a 25% chance of getting a question right to a 50% chance of getting it right. All right. Scotty, yeah, so unless it's a SATA question, so if it's a SATA question, never evaluate two SATA questions together, right? If it's a SATA question, or if we're talking about percents correct, yeah, if it's a SATA question, never look at two answer options together, all right? And what I mean by that is, we talk about the SATA success pyramid. This is one that I throw out in a different tutoring session, but I call this the SATA success pyramid. And essentially, if you see a SATA question, you got to cover all the answer options and evaluate every single answer option individually of each other. Because what happens a lot of times with these SATA questions is we say, well, B is close to right and B is kind of like A, so maybe B is right and A is right. When it comes to SATA questions, evaluate every single answer option as if it's a totally separate question. When I'm talking about opposites and the same, I'm talking about when you're just given 4 answer options. So you're given 4 answer options, you have to find one correct answer out of those 4. So if it's saying the opposite thing, one of them is usually right. If it's saying the same thing, they're both got to be wrong. All right. So Donna asks, on the NCLEX, for SATA questions on the NCLEX, there is no partial credit. No, you don't get any partial credit at all. I tripped that one. No, that's cool, Scotty. I'm glad you brought that up because I need to be more clear about that as I teach that, because SATA questions are kind of an entirely different beast on their own. So it's important to look at those completely differently than anything else. So yeah, no partial points at all for SATA questions. You get them all right or you get them all wrong. Let me give you another thing about SATA. Is that okay if I give you guys a couple other tips about SATA? So the SATA success pyramid, cover all the options, evaluate each one individually, and evaluate them as true-false statements. The other thing I'll tell you is, according to the NCSBN, now the NCSBN is the company that writes the NCLEX. According to their rules and what they say, anywhere from 1 to every answer option can be correct on a SATA question. So that might be a little different in your school. They might say, well, it always has to be 2 or it can't be all of them. And that's fine if that's how your school does it. Play by those rules. But when you go in to take the NCLEX, realize that for a SATA question, it can be one of them right or it can be all of them right. All right? So that should help a bit with those. Yeah, so our Dargis, so for questions about priority, I know ABCs come first, but what is NCLEX priority? That's a really good question. So NCLEX priority is going to look like this. This is something that we call the ABCs, DEF. So if you look ABC, S, D, E, F. So ABC, airway, well, go ahead and tell me what all those are. Yeah, so essentially Maslows, and we've reordered Maslows a little bit to help you break those things out. Yeah, so ABCs are airway, breathing, circulation. S, you see that little S after the C? That stands for safety. All right, so you're going to always address, yeah, perfect. Airway, breathing, then circulation, then you can deal with safety. All right, and once we've dealt with those 4 things in that order, then we can deal with pain or discomfort. All right, and once we've dealt with pain and discomfort, then we can teach our patient. And once we know that they understand, that they're understanding things, then we can deal with their feelings. So really, we've taken Maslow's hierarchy of needs and we've kind of turned it around. So physiological needs on the bottom, breathing, food, sex, sleep, homeostasis, excretion, that deals with our ABCs really. And then safety and security, that's our S. Love and belonging, self-esteem, self-actualization, that deals with our education and our feelings. Where I think it gets really tricky to people on the NCLEX and as they take tests is ones that deal with airway, breathing, circulation. You know, which would you see first? And you're like, well, man, this patient's blood pressure's low and this patient's vented. Which one would I see first? So realize that you must address the ABCs in that order. Do I have an open airway? Meaning, can I get air in? Okay, A for airway stands for getting air in. Do I have an open patent airway? Breathing is, can I exchange that gas? Can I exchange oxygen and CO2? Circulation is, do I have fluid in my pump? You know, do I have enough fluid to pump around my body? And then safety can be physical, it can be infection, it can be all those things. So if I have a patient who just fell out of the bed, you know, the first thing I do, I don't run in that room and I don't say, hey, you know, we have a call light, we got to deal with that call light. No, I assess my patient, make sure they have an airway, make sure they're breathing, make sure they have circulation. Then I deal with safety. You know, is their skin okay? Is their bones okay? Do I get a CAT scan? Let's get them back into bed, address their discomfort or even pain. Is everything okay? Now I can start talking about education, say, hey, this is the call light, this is how you push it. So you got to kind of walk backwards with all those situations that you're given in questions and say, where am I at with my A, B, C, S, D, E, F? Where am I at in those A, B, C, D, E, F? With each patient. Do I have an airway? Can they exchange? Do they have circulation? And are they safe? Okay. Cool, guys. So that's a pretty quick session when we talk about opposites and the same. That's honestly all it really is. And if you guys want to dive in more, I suggest, let's see if I can get this to pop up. I suggest you go over to the test taking course, because inside that test taking course, I go in a little bit deeper, and there is the cheat sheet in there. Excuse me. So if you go down to the test taking course, and then there's a little bit more detail about opposites and same. And then we do have the test taking cheat sheet that you guys can get access to, that you can read. And that's going to give you all these 11 kind of hacks, or these kind of tips. Now, these tips are, again, like I always say, guys, test taking strategies are good, they're helpful, but if you have the knowledge, this stuff doesn't really matter, because you can answer those questions and you understand. But regardless of how much you study, you're absolutely going to encounter some of those questions on the NCLEX that you've never been exposed to that medication before. You know, you don't know what that medication is, or that disease process, or you just can't quite remember. That's where you can drop these 11 tips and these 11 strategies to help you. So that's where those things are going to help you. That's where they're going to be most beneficial, is when you encounter questions that you're not really sure about, or you haven't seen that disease process before. So that's when you start with these 11 different strategies and say, okay, which one can I apply here? Is this an NCLEX question trap? Is this an opposite versus the same? Is this a priority question? And you can start applying some of those tips and strategies that we teach you inside that test taking course. All right. What questions do you have, guys? Whether about this or about something else, we can hang out for a few minutes, answer some questions, and then we need to get our Singapore friends to bed. It's 2 a.m. All right, so Scotty says, I went to an NCLEX prep drop-down menu in the new system and tried to select a session I hadn't registered for, and it tells me I need to add the NCLEX package. Do I need to add it as a lifetime member? So the NCLEX package is now kind of a totally different thing, and it's going to look different to you guys being members, but what we did is we pulled out some of the, so we created a new, we created like a whole new NCLEX package for users. So those users who didn't have lifetime or anything before, there's this whole new product now for them where they can do NCLEX specific things, including SIMCLEX, NCLEX strategies, and NPQ. So yeah, that's a whole separate package. If you have questions, Scotty, support could definitely point you in the right direction. That's over, and they had a, if you just email them contact@nrsng.com, they can help you out. What's up with Picmonic? Are we able to get a discount? So Picmonic, I believe, has a discount to Picmonic if you're an NRSNG member. But the way that the Picmonic works, sorry, that's my son calling. So lifetime membership does include NPQ. Yeah. So yeah, there's a whole new tutoring category called NCLEX Prep, which is just for the people who purchase an NCLEX Prep package. So separate for them. Hold on. Okay, so I was talking about Picmonic. So with Picmonic, the way it works is if you have a Picmonic membership and you use NRSNG, you'll be able to view the Picmonics inside NRSNG. Okay. And I believe that Picmonic has a discount for Picmonic if you're an NRSNG member. So if you click on one of those Picmonic pop-ups, it should send you to some discount they have. I honestly don't know how much it is. But if you already have a Picmonic membership, it'll appear in NRSNG and you'll be able to access it. Yeah, so all the regular tutoring is still available. It's just a whole separate category of tutoring for NCLEX focus for those NCLEX users. And I believe Marie does most of those. Cheat sheets are printable for unlimited and premium users, yes. So the physiological adaptation, I have to look at it. Yeah, so the physiological adaptation would be one of the new NCLEX focused tutoring sessions, which is a whole separate product. So you have NRSNG Premium, NRSNG Unlimited. That's included your NPQ. It includes all the courses, most of the tutoring, and then in NRSNG NCLEX includes NCLEX focused tutoring sessions, Simplex, and NPQ. So RAVNet, the NRSNG NCLEX package is a whole new separate product, but as a lifetime member, you do have access to, we've given you access to the new Simplex that's come out. You get 3 attempts at that. So there's the NRSNG Premium, which has access to courses and things like that, and some of the tutoring sessions, the stuff that's best for school. And then there's NRSNG NCLEX, which now has the new patent pending Simplex, completely redone product there, NCLEX tutoring sessions, and some questions. That tutoring is not available to lifetime. Yeah, it's a whole separate product, just available through the same dashboard. That's right, Scotty. No, I know it's, I know there's some confusion with it out there with us launching this new NCLEX product, and so it's fine. Most of the questions are going to be best answered by support. They kind of have access to your account, so they can actually look at your account and tell you. Just through the chat here, I'm not able to look at accounts and everything like it'll be more helpful through them with just through email or chat with support. Cool. Hopefully that session helps a little bit. I know, and I think a lot of this test taking stuff is really helpful while you're in school. And if it's stuff that you keep in the back of your mind as you approach NCLEX, it's going to be just as helpful then, especially as you walk into that test. And that's the scariest thing I think about NCLEX for a lot of people, is when you walk in there, it's something unlike anything you've seen before. Oh, yeah, I thought we already talked about that. Yeah, so always nursing process. Absolutely. Nursing process is always the thing. I thought I had to talk through that. Yeah, so nursing, and that's a lot of what the NCSBN cares about, and that's really what they care about more than anything, honestly, guys, is that you're going to be a safe nurse. So when you walk into your first shift as a registered nurse or an LVN or whatever, that you're safe, that you're not going to kill somebody, because it puts your license on the line, it puts their jurisdiction on the line, it puts all of us on the line as nurses. So they want to make sure you're safe, and that's kind of the backbone of the nursing process, right? It's am I doing things in the right order to be safe? Am I getting enough information before I implement anything? And so that's really the whole point. Yeah. So yeah, always stick with the nursing process. Frank says, does the NCLEX know those students that are retaking the NCLEX? Frank, I honestly can't answer that question. I don't know. So when you walk into the test, it generally gives everybody kind of the same level of starting point, and then based on how you do. I don't know that they're going to say, hey, Frank's already taken the test, and this is how he did, so we're going to give him a different question level. Even if they know that you're a repeat test taker, I do not believe that they're going to pull up your old data and say, this is how he did last time, so we're gonna give him an advantage or disadvantage. I don't think that it works like that, but I haven't seen any writings from the NCSBN on that. I believe every attempt you take, you're given a fair shot from the beginning. Yeah, that would be a good way to look at it. Is honestly start with the nursing process, look at the ABCs, and then the rest of the things are honestly hacks and tricks and things like that. Yeah. So NCLEX changes every 3 years. The most recent change was in April, May of this year. So it's good until 2021, 2022, so 2 or 3 years. So there won't be any changes for another couple years. So if you're in school now, you're going to take the NCLEX as it stands today. Their plan, the NCSBN's plan, is to roll out this thing called the NGN, or the Next Generation NCLEX, with this next one that happens in a few years from now. And that's all the horror stories and rumors you've heard about these essay style questions and things like that. So they're planning on making it more like case study based and things like that, like him says. So, but that's not happening for a couple of years. So if you're in school now, or if you already have the NCLEX planned, it's going to be as it is. They've planned on doing this next generation NCLEX for the past several changes, but it's a huge rollout. It's a huge change. So they're now planning on it for the next change in a few years, but they weren't able to make it this last year. So yeah, pass it and don't worry about it, like Frank says. But so when you walk into your NCLEX, however, you might get some of these case study questions, and that's because they have to have enough data on all these types of questions to see if they're good questions or not. But there's 15 of your questions that aren't going to count against your score, if that makes sense. There's 15 questions that they're testing new question types or testing new questions. So even if you see those kinds of questions, they're not counting towards your score, your pass or fail on the NCLEX. Hopefully that makes sense. So you might see some, but they're not counting. And then it's the new change. The big change is rolling out in a couple of years. Anticipated. It didn't happen this time. But that's all called the next generation NCLEX. Again, if you're in school, don't worry about it. Get through school, worry about, SATA questions, regular questions, all that stuff. And again, even when that new next generation NCLEX comes, the same basic truths hold. Learn everything that you can, work through the nursing process, work through the ABCs, and it's all the same there. It's just different question types. Appreciate it, Frank. And if you guys, so as you begin to approach the NCLEX, this new SIMCLEX that rolled out today is an enormous advantage to you. This is the most realistic NCLEX practice you're ever going to see. Our engineers have been diving into the research, the studies, making it more and more and more and more realistic, more concise, more precise. And then we rolled out even a kind of a graph to show you how you're doing. Now, prepare as you're getting towards the NCLEX to take those SIMCLEX. Take one 6 weeks ahead of time, one 4 weeks ahead of time, one 2 weeks ahead of time and stuff. The NCLEX is no joke. I studied a ton, I prepared a ton, but even when I walked out of the NCLEX, I was like, I have no idea how I did. So we updated the NCLEX study plans to reflect the adjustments with the SIMCLEX, that it's going to be a more realistic, even more realistic indicator for you now. So there's 3. You can take 3 SIMCLEX. And again, so I think where some users were struggling, and we realized this last week, where some users were struggling is they were using SIMCLEX from the beginning. That they were saying, I'm going to go in, I'm going to practice questions, I want to practice SIMCLEX right from the beginning. Where the better use case for it is, as you already have this bank of knowledge towards your last semester, or after you've already graduated and scheduled the NCLEX, that's when SIMCLEX becomes most valuable. Before that time, you should really be working through NPQ. NPQ is where you can, trying to turn off I don't remember how to turn off my camera. But NPQ is where you have access to as many questions as you want on any topic. You can view the results. So it's really best to spend your time in NPQ and watching the courses and getting your knowledge base up and getting your questions up so that when you approach nclex, it's already like the real thing, and you can get a better gauge on where you're at. And I'll look at that. I'll bring that up with engineering guys and see if there's a way we can adjust that. Cool. So Karina, that's a good question. And if you look at our YouTube channel, one of our most recent videos actually talks about the algorithm used in the NCLEX. So the NCLEX doesn't care how many you got right or wrong. What it cares about is the difficulty of the questions that you get right, if that makes sense. So one user might pass in 75 questions and only get 20 or 30 questions right. Another user might fail and get more questions right. And that's all based on something called 95% confidence interval. And it's based on how sure they are that you're going to get a question right or wrong. And they want you to be above a specific difficulty level. That's essentially how it works. If you look at that YouTube video, I talk about it for about 10 minutes. I kind of go into it, but it's less a matter of how many and more a matter of how difficult the questions that you saw were. Yeah, Ravneet, would you email support and they will be able to get you that link? I don't have it. I'm not exactly sure where that is, but they can get you those. So if you email contact@nrsng, they'll get you that for you. Cool, guys. I appreciate you guys taking some time with me today. It's a busy Tuesday, into the summer. I know you guys are getting close to school starting back up or taking your NCLEX, so I really appreciate you guys. Krishna, Marisa, Ravneet, M, Frank, Sue, Gailey. Now some people are talking. Zoo, we didn't see you the whole thing. Karina. Yeah, cool, guys. Appreciate it, guys. All right, have a good afternoon. Get some rest tonight. I really appreciate you guys. And like we always say, happy nursing. All right, guys. Nice. Thanks, guys. Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.